Hi there, it's Gavin Noble here from Gavin Noble Physiotherapy. So today we are going to talk about shoulder pain, and more specifically we're going to talk about frozen shoulder. So if you are someone who has been diagnosed with a frozen shoulder, or if you know somebody who has frozen shoulder, then the information we're about to talk about will be very useful for you. So what is frozen shoulder? So obviously it affects your shoulder. It's what we call an adhesive capsulitis. So our shoulders are encompassed by this capsule, which helps to protect the shoulder, hold it in place. And this basically becomes thickened due to a lack of the synovial fluid, which is really just the oil in the joint, helping to keep it free and mobile. So this lack of the synovial fluid then tends to lead the shoulder to become tight, become stiff, and then with that then you get more pain. So this typically occurs in 40 to 60 year olds, and ladies, I'm sorry, but it does tend to affect more women than men. So generally there's two types. First is primary. So this primary frozen shoulder is basically, there's no known cause, it just happens. It's just one of those things. And then the second reason why it happens is post-surgery. Again, it's just because you've had a little bit of surgery in the shoulder, things do stiffen up. Now there are also other risk factors that are involved. One of them being diabetes. Other one is post-stroke. Another one is general immobility of the shoulder. And then finally, really just other shoulder injuries. So these are things that can lead to that frozen shoulder. So one of the hallmark signs of a frozen shoulder is being unable to move the arm or shoulder, and that is even with the help of other people. You'll just not be able to move it because the pain can be so great. So things that you may have done are like to get an x-ray or an MRI scan done of the shoulder. Unfortunately, sometimes the frozen shoulder doesn't always show up on these kinds of imaging. So as the condition progresses, everyday activities can be severely affected. So things like dressing, grooming, self-care, even reaching overhead, behind your back, they all become more difficult. Lifting is also painful. Pain is also felt at night, which affects sleep. So if that sounds like that's what happens with you, then you do need to get help as soon as you can. We're going to talk a little bit more now, just a little bit about the different stages of the frozen shoulder. So generally there's three stages of frozen shoulder. One, freezing, second, frozen, and third is thawing. So let's look at the first stage, freezing. So this freezing stage happens sort of between the 6 weeks to 9 months time frame. There's a slow onset of pain, and we start to get a bit of decreased range of movement in the shoulder. Then we move on to that frozen stage, which is in general lasting between the 4 to 6 months time frame. Pain does generally diminish at this stage, but however, we are still a bit painful on movement. The shoulder is stiffer and daily activities are affected and very restricted. Then we move to the thawing stage. So this thawing stage takes between 6 months to 2 years. So your range of movement will slowly return to normal. the shoulder pain, this frozen shoulder, can generally resolve on its own, but as you can see, it can be a very lengthy and painful process. Full recovery is not usually guaranteed, but it can occur. Okay, so now let's move to what physio can do for you. So the main thing that we want to really focus on with physiotherapy is preventing any related neck and shoulder problems. So with that, we will help reduce pain. We will help to increase the range of movement. We'll decrease that muscle tightness and generally just start to help improve things for you. So how do we do that? We do that with a variety of different things. We can use heat. We will help you stretch. We'll use manual therapy techniques where we'll help to mobilize the joints. We'll use muscle activations as well, and lots of soft tissue release. So remember, with stiffness and tightness, we want to get things moving. So the idea to help reduce that stiffness is just to get things moving. Really important for you and help you return to as much normality as possible. So we'll help you with exercise programs, and again, just with our assessments, we'll really help you with specific exercises for you. And that's the most important thing, that everything we do is tailored towards your problems and getting you back to doing the things that you want to be able to do. So we'll help you get that shoulder strengthened. We'll help you get it moving, decreasing that stiffness, decreasing that tightness. There's a lot of onus on you as well. So the more you put in, the more you get out. So yes, you do need to work hard with us, with the physios, but at the end of the day, your rewards will be less pain, better function, back to doing things that you love doing, and most importantly, a quicker recovery time. So as you can see from everything that we've talked about in the video, the length of time the frozen shoulder can go on can be anything possibly 2 to 3 years. So physio is really important for you to help you get back to doing the things that you want to do in a much quicker time frame. Anybody I've ever met with frozen shoulder never wants to be suffering for more than 2 years. Even less than that, they don't want to be suffering at all. They all want to be doing the things they love doing. So if you have any questions, please feel free, give us a shout, pop us an email. We will do our best to help you get over your frozen shoulder. Again, if you know anybody who has frozen shoulder, please feel free, pass this video on to them. And again, as ever, please like the video, subscribe to our page, and share away with your friends. Thanks again for watching, and we'll catch you at the next video. Thanks.